I'm Marilee Long. I'm a professor in the Department of Journalism and Technical Communication at CSU. My focus area in the MPH program is health communication. And in the Colorado School of Public Health, I'm in the Department of Community and Behavioral Health. In the health communications focus area, I teach the health communications course, JTC 630, and sometimes we offer special seminars on health topics. The work that I do in health communication research is I often look at the media messages about health and how those influence how people think about their health, how they might support public health initiatives, how they might vote, for example, in an election that might have a public health initiative such as a smoking ban. Would they be in favor of it? Would they be opposed? In part based on what they've heard in the media messages. I also look at individual level behaviors and how media messages influence individual level behaviors. And those can be media messages that are in traditional media as well as new social media areas. And so a lot of it is looking at how those messages influence attitudes, behaviors, knowledge, that sort of thing. As far as current issues and trends in public health in the area that I'm in health communication, a lot of it is looking at how messages influence individual level behaviors as well as public health initiatives and the support for those that the public has. Are they, for example, if you think about New York City and its ban on big sodas, how did coverage of that influence the support that the public had for that? When it comes to looking at even things like medical marijuana and support for that, or changes in what the schools do as far as does the public support more physical education or not? How do media messages influence that public support? So I've looked at both individual level stuff as well as more, we might consider like more community or societal level behaviors when it comes to voting and that sort of thing. In the public health sequence in the health communication focus area, we offer several courses, one of which is JTC 630, which is our health communication class. And in the health communication focus area, students take that, but also students from across the public health program take that course. We also offer a course that's a basic communication theory course that health communication focus area students take, but not all MPH students have to take or would be that useful for them. For students who are really interested in health communication, it's a great course to take and gives you a broader understanding of communication. So, and that course I teach occasionally as well. And then as far as courses I would recommend for students to take in our health focus area, the two big ones would be public communication campaigns, and that class again does help you to understand, regardless of what the topic is, how to launch a campaign, what the theoretical backgrounds are, and how to apply that information, and takes the theory and makes it very practical. And then health communication is the other one, which also again looks at, theoretically it's going to talk about why people do what they do, how they respond to health risks, why they will do things and won't do other things, and why in the face of what we think is really clear evidence for them to change a behavior, they're hesitant to do it or they're just going to ignore it. So it helps us to understand it, and then again take that theoretical understanding and look at the practical application of those messages and what you can do to help people.